Stephanie Berthelot and the crew at SR Enterprise can handle it all, from sheetrock to texture to paint. Give Stephanie a call at 504-432-9284. SR Enterprise, where they spread the paint and you spread the word. Well, when we say local leaders on this podcast, we mean it. Our guest today is a local talent, grew up right here in Denham Springs, graduated from Denham Springs High School, go Jackets, and chose, keyword there, to build his business right here in Livingston Parish. So with that, welcome Donald St. Angelo of Advanced Dental Care.
Thank you, Jim. Good to be here.
So you have a lot going on in your dental practice, and we're definitely going to dig real deep into how you're innovating your dental practice. But first, before we do, I want to hear a little bit about you personally, your background growing up here, and your family life. So tell us a little bit about that. You grew up in dental?
Yeah, sure did. Lived right off Jubin Road. Mom and dad still here. I've got a wife, 2 kids, great kids. One's 6 and one's 7, first and second grade, right here at Denham Springs Elementary. My wife's from Walker. So she's pretty local girl too. Yeah. Didn't venture too far on that.
Awesome.
Grew up there. Went to Denham High. Graduated in 2002. Stayed local. Went to LSU to do all my undergrad studies, and then after doing that, went to New Orleans for LSU's dental school.
Okay.
Came on back home and.
Here I am. You are. Well, we're glad you're here. By the time this podcast is over, what I want everybody to see is the different offerings that you offer at Advanced Dental.
Sure, yeah.
So first question I have is, when did you know you wanted to be a dentist? This is something I'm personally curious about. I'm sure all our listeners out there are curious about it, because I don't have a scientific bone in my body. I am the total opposite of science, whereas my son, who you know, he is all about science. And so it's just a different type of way that the brain works in that capacity. So at some point, Dr. Don was, before you were Dr. Don, you decided, I think I'm going to be a dentist. Tell me about that.
So I was that weird little kid who loved to go to the dentist.
Yeah.
Really, when I got braces and started doing my orthodontics and everything like that, that's when I really got into it. I loved going. You'd go every several weeks. Yeah. And I got really used to kind of that environment. And that's what I wanted to do. I wanted to be that guy. I wanted to, have that awesome interaction with people and just, have a blast at work while you're helping people.
What age were you when you?
So that was 14, I believe, 13, 14.
Wow. Yeah. And you knew at that point, you're like, I think I want to be a dentist.
That was at least the direction I wanted to head towards. And like you said, some people like math, some people like reading. I loved science. All the science stuff was cool to me. So yeah, I knew my studies were going to at least lead me in that direction. So kind of getting in, fixing to graduate high school, trying to figure out where am I going to go in life, looking at different careers and things. Yeah. Dentistry just continued to stick out in my head. And it seemed to be just a wonderful way I could do what I wanted to do, provide for my family, and just.
And here you are. You're a dentist, and you've achieved that goal. Huge, anytime you're a doctor, that is a huge achievement in and of itself. But the great thing about you is you knew at a young age, that this was where you were kind of headed. And that's something people my age, we look back and I feel very blessed that I do what I love to do. And I found my passion in life kind of early. Some people struggle. They might be 40 years old and they're still in a field. Maybe they hate going to their job, and that's gotta suck to put it quite honest, frank and honest. But you found your calling kind of early, and just an excellent dentist. You have a phenomenal reputation here locally. So I'm curious. You go to LSU and you graduate from LSU Dental School, and you're out there, and now you've got to figure out, where should I practice? I'm sure at some point that really ran through your head. Where do I want to put my office?
Very much, yes.
That's a major commitment. For me, if I'm naming a business, I'm like, man, you want to make sure the name is right and that it attracts people. And so where you're going to put your business in a dental capacity is very important. Many folks don't realize it, but per capita, Livingston Parish has the highest population of dentists in the country. Now, I totally just made that stat up. I don't know if that's accurate or not, but there's a lot of dentists in Livingston Parish. A ton. So with all that being said, what made you choose to come back home? What was kind of the deciding factor on that?
Denham's home. It's my home. I knew my kids needed to be raised here. I mean, it's a great place. We did. Me and my wife had that conversation while we were, when I was fixing to graduate school. It was like, baby, where do we want to go? Where do we want to live? What do we want to do? And it was an easy decision. All of our family's here. Everybody's here that we love and care about. And we needed to come back to this community. And here we are.
Yeah, so it was really a no-brainer.
Yeah, for
you.
us it was easy.
Yeah, that's great. And that's something that I get that. And that's something that a lot of people in a community like Livingston Parish, they feel that way. It was never a consideration of leaving home. We have a lot of talent in this parish relative to, not only dentists, but we have business owners that are extremely talented here. Gator Millworks, for example, just put a big building right there on Florida Boulevard going towards Walker.
Beautiful building.
Beautiful
nice?
Building. And what an investment in this community that was. And so all of you as business owners, you're not only putting your business here because you're putting your business here, but you're also investing in Livingston Parish. And that means something to me. And hopefully it means something to all our listeners out there that, you invested your business here, and that's special. That means something. So I want to also ask you, I know that, 2016 businesses flooded. Yours was one of them.
That's right.
So how did you turn a negative into a positive? You go in there now, and I'm telling you, he'll sponsor tours on his office over there, but his office is just beautiful on the inside. And I flooded as well. My business flooded as well, but we turned a negative into a positive. How did what were your thoughts after the 2016 flood? Were you just like, oh man, let's really try to, I'm sure you had the same reaction everybody else did at first, which was, oh my gosh, what am I going to do? And then there was a point where you said, you know what, we're going to grab a hold of this and we're going to make it better than it ever was.
Oh, absolutely. It was, just devastation at first. What do we do? Where do we go from here? And then just like you said, you just got to look at that glass half full. We looked at it as an opportunity. We knew we were going to remodel the office and make it beautiful and make it something special. All the little things on the inside that, you look at and you'd love to tweak and just kind of fix. We just took that advantage and tweaked them and fixed them how we wanted to and just made the office flow really nice. It's got a very nice, clean aesthetics to it.
Colors are beautiful.
Thank you. Yeah, it's it really turned out nice. It's great because it was an older building. That building's been there since, gosh, I want to say it was built in the 1950s, maybe.
Really?
Yeah.
Wow, that's it.
Yeah, the dentist who was in there before me, he's had that building for quite a long time. It used to be a house at one point.
Oh, okay.
Yeah, funny little thing. So when we were tearing down some of the walls and stuff after the flood, there was a fireplace in there.
Really?
Yeah, it was all boarded up.
So you didn't even know it
never
existed?
Even knew it was there. Yeah,
that's awesome.
That was a cool little find.
Yeah, that's really neat. And you go in there now, and it's just state of the art. I mean, everything is beautiful in there, and just a very impressive dentist. it doesn't make you feel like you're going to the doctor. It makes you, you know, and I'm assuming that was something you were kind of aiming for, almost like a spa-like atmosphere where you're going to the dentist, but it's an experience. That's the best way I can kind of explain it. So kudos to whoever your designer was, your decorator, probably your wife had a lot to do with that.
She did, yeah.
Yeah, well, you did a great job there. Now, there are a lot of things in researching you know, more. There's a lot of things that separate you in regard to what you bring to the table as a dentist. A lot of dentists in the area, a lot of good dentists in the area, but the services maybe some offer versus others will vary a little bit. You bring a lot to the table. The first thing that stands out to me are the amount of certifications that you have. You got a lot of them. So I want to cover some of those, and I want you to kind of explain them to me. So I'm gonna list out what my knowledge is on that. And one of the things you're certified in is nitrous oxide sedation. Laughing gas?
Laughing gas, aka laughing gas. That's it.
Okay, so you're certified with nitrous oxide sedation. So I assume this is for people that maybe get really, really panicky when they go to the dentist, or they just want to relax a little bit.
Sure. Sometimes it's just as simple as maybe just getting through the injection to get numbed up. They just like a little, just ease their nerves just a bit. It just kind of smoothly takes that edge off. Others, they love staying on it the whole time. You know, they'll take a nap or something. Yeah, it's really great. It's super, super safe. It's very, very effective.
Do people really laugh on it?
Sometimes some people get some giggles.
I'm thinking I would.
No, for the most part, people are just a little more laid back on it, though.
Yeah. Okay. So it just kind of eases them a little bit. You also do you're also certified in oral consciousness sedation. So is that Twilight? Is that what?
So that's Twilight? Yeah. So, it's not complete sedation where I can't talk to you, I can't wake you up. It's you're kind of in that little twilight zone where you really don't care what's going on. You're maybe taking a nap, but I can talk to you. I can say, "Hey, Jim, turn your head my way a little bit. How are you feeling?" It provides great communication, so I can keep a really safe watch on the patient. But at the same time, they're in that great state where we can get the work done that we need to do.
They're probably telling you their deepest, darkest secrets that you'll never reveal.
I won't comment on that, Jim.
Yeah, I've done some research on that in the past. I'm a curious guy, believe it or not. So basic life support and pediatric advanced life support. You're also certified in those?
That's right.
Okay, so tell me about those.
So that's a requirement if you're going to sedate children with the minimal, the moderate conscious sedation. We don't do that in the office, but I felt it's good to have that, if you can't be overtrained, you know what I mean? So we try and just stay up and up. Our kids are super important when they come in the office, and we want to make sure that they're absolutely as safe as they can be. And if something was to go wrong, we are more prepared possibly than we would need to be. So.
Wow.
Yeah, we try and do that.
You definitely have certifications going on. And are these things that you have to maintain every year, like through CE credits or I don't know, CEU credits? Or?
Yeah, each year, I think it's about 20 hours of continuing education that the dentist is responsible for. The staff are also responsible for X amount of hours per their license and things like that. Mm-hmm. But that's another thing. We love education. When you get your dental license, it's a license to learn.
Right.
It really is. There's you can go so far with it, and you can take it as far as you want to go. And we love to just see how far we can go with things and learn all, the newest things and the best things, and
things change too. It's funny. My wife, she has to get, of course she has her CEU credits that she gets, but she also, I find this interesting. So they do the, and I'm totally drawing a blank, but when they, what is it? The
CPR.
Thank you, CPR. Thank you, McHugh. They do CPR, and CPR has actually changed several times over the year. It used to be, 5 to 1s or 3 to 2s or whatever. My wife tells me, and she's going to watch this and be like, I cannot believe you couldn't remember. So but it's changed so many times, and every year she has to get obviously recertified in CPR, and several times over the years it's changed. So I would imagine that's the same way no matter what you're doing. Science finds a way to advance, and so that's why those CEUs are
absolutely, especially medicine. They're constant new discoveries, constant learning of facts, and just getting a better grasp on things.
Yeah.
Dentistry now compared to 10 years ago, even almost a total different ball game.
Yeah, I can imagine.
Big difference. Yeah.
Yeah, and so you're a member of a lot of associations too, with regard to the Louisiana Association of Dentistry, and tell me about some of those that you're a member of.
Yeah, so there's a national level, the ADA, American Dental Association. There's a state level, Louisiana Dental Association, and then we also have a local, local organization, the Greater Baton Rouge Dental Association, things like that.
Gotcha.
And they're all there. They're in place to kind of one thing, regulate the profession as a whole, which is great. But then they provide guidance, especially with the coronavirus and everything. They've played a huge part in establishing the regulations and protocols that dental offices need to be doing right now to keep everyone safe. So they're a huge component in all that kind of stuff.
Yeah, and we're gonna get to that. I do have some questions about that with regard to that. But you're also a member of the Livingston Parish Chamber of Commerce,
right.
Which is we're Chamber of Commerce people around here. I think that's an organization that everybody needs to support. I was happy to see that you support that, and good for you on that. B&I, you're a member of Business Networking International, great referral organization there. So you're an involved guy, to say the least, and
stay busy.
You stay busy. There's no doubt about it. Now, some common questions I wanted to make sure we cover with regard to the services you offer are on the basic dentistry side, and then we're going to get into the more advanced kind of dentistry side. So basic dentistry side, if I'm someone and I call your office and I say, what exactly do you do on the basic dentistry side? Fillings and what else?
Sure. Yeah. All those, those normal things you think of: fillings, cleanings, crowns,
bridges. Yeah.
Bridges, dentures. I guess all these things could fall into, tooth extractions could fall into the basic category of things.
So pretty much all of that. And do you have a certain age of patients you see, or?
No. So we, that's one of the big things in our office. We love to see kids, and people ask me that all the time. Do you see kids? Because a lot of people, they're used to going to a pediatric dentist.
Yeah.
And we rely on our pediatric dentist a lot too to help us out with some, more difficult cases. Remember, I was saying we don't deep sedate the children.
Right.
So if we have some kids that will, maybe require some deep sedation, we call our guys and get them to help us out on that. But so the kids, and then, they take special insurances and things like that. But we take all that. We love to see kids and families. I think it's super easy for a mom and dad to make their appointments with their kids and not have to go to 3 different offices to get everybody taken care of.
A lot of multi-working families where the wife and husband both work, and if the wife can get off for her dentist appointment, bring her kids at the same time, that's huge for her,
right?
Or him.
Yeah, how hard is it to go all around town and take a whole day off and do all these things?
Yeah, and exactly. And when my situation, I've got 3 kids, so it's my wife takes care of most of that. Thankfully, she's awesome, but it's tough. It's tough. So you make it kind of easy for people, and obviously we all appreciate that. But do you have like I would imagine dentistry more than anything else. Bedside manner is important in any sort of medical field. Dentistry, I think it's ultra important because people have to feel comfortable.
Absolutely.
One of the things that you're known for is your bedside manner. You know how to make, whether it's a child, an adult, doesn't matter. You know how to make them comfortable. And so for listeners out there, if you're looking for a dentist, for your 6-year-old, Dr. Don be a great choice because he's going to make that kid feel comfortable. And all those sorts of things. But you would agree with that, the bedside manner is a big part.
I think it's huge. Like me and you were saying earlier, sometimes the technical aspect of things, maybe people that's not as important to them as how they feel when they come in. Yeah. And from the moment you walk in the door, you're immediately greeted by my guy at the front. Keaton, he's going to call you by name.
Yeah.
Miss So-and-so, good morning. How are you?
Yeah.
We try and let people know we're here to take care of them. We know people are nervous coming in. We know they don't want to sit in that chair sometimes for, a long time and get all this dental work done, which can be uncomfortable. So if we can ease them into that and just calm their minds and just help them feel good about it, we are all about that.
That's right. And we were talking before we started airing here about people and how important your staff is to business. And this goes for any business out there. Dr. Don certainly acknowledges the fact that his people are a huge part of his business. And that's what leaders recognize. And it's a very important aspect of leaders is their ability to recognize that their people really make their business in a lot of ways. Yours are great, all of them. It's probably when I hear people talk about advanced dental care, that's one of the biggest things they say. The most common is Keaton or any of the ladies over there that help you, from your hygienist to your your staff that's up front taking appointments. Everybody does a great job. So kudos to y'all for that, and check that out. If you're out there listening, go by there and say hello to those people, because they're awesome. LeAnn's Flooring by Design, conveniently located on Florida Boulevard in Denham Springs. LeAnn can service all of your flooring needs. Give them a call for an appointment at 523-7004. At LeAnn's Flooring by Design, they stand behind everything you walk on. Let me ask you, so how important is dental hygiene in general? Is it true that if you have bad dental hygiene, it can even contribute to like mental issues such as like depression and things like that? I've heard that, bad dental hygiene can cause.
Sure. So there's an aspect of it like that, how you feel about yourself. If your teeth are clean, they look great, you feel good, you smile more. Smiling more, it makes you feel better. You're a happier person. You can accomplish life a little easier maybe than somebody who's depressed and things like that. So just, that small aspect, that can have a huge impact on somebody. And then from the biological standpoint of it, that bacteria in your mouth can get in your bloodstream. It can keep you feeling tired. If you're clenching and grinding your teeth or sleep apnea, all these things can pile into your physical health, not only your mental health. And yeah, it's a big part.
Yeah. And I'm sure there's people out there just like me. You go get a cleaning, just a basic cleaning, your 6 month, and you go in there, and when you leave, I mean, you just feel good. It's like, man, I feel like I got brand new teeth here, and I brush my teeth 3 times a day or whatever. But it's different when you go to the dentist. It's like I don't know, magic toothpaste or something y'all got over there.
We can reach that itch that you just can't scratch sometimes.
You go out and you just feel good. So you're absolutely right. Just your mental attitude kind of changes so very important in that respect. Let me ask you, what do people not do enough of, in your opinion, that could avoid unnecessary trips to the dentist? Like, what's something you would recommend people really focus on other than just brushing their teeth?
Just those regular checkups you mentioned. Yeah. We catch problems when they're small. They're easy to fix when they're small. They're less expensive to fix when they're small.
Sure. And
those small problems, when they get bigger, they bleed out into other areas, and they cause, it's just like a domino effect. We can see teeth just continually go downhill. So I would say the biggest thing is, do your home care. All that's super important. Come in for your 6 month cleanings and checkups. That's when we're going to find issues, if there are issues.
Okay. And that's a good point, because it'll save you money too. I mean,
for sure.
If you catch a cavity versus having to do like a root canal or something like that, imagine the difference in money. So that's a good point. And y'all offer at Advanced Dental Care, you can get like Sonicare toothbrushes and things like that. Do y'all sell those?
We do. Yeah. We're pretty excited right now. Oral-B just came out with a brand new one, the IO.
Oh yeah!
Oh my goodness! I tried it out last night actually for the first time. Mine just came in, and my goodness, my teeth. And I'm a stickler about it. My teeth feel great after brushing with that.
So tell me about that. What does this machine do?
So it uses Oral-B has this oscillating reciprocating action on their heads. It basically just kind of turns a certain way.
Yeah.
Well, they've amped that up and they've added some ultrasonic vibrations to it. So you get the best of both worlds. You get the ultrasonic along with that motion from the mechanical side of it. And man, it is like a
party in your mouth.
Oh boy, it's great.
That's awesome. Well, send me information on that, and I'll link that what he just discussed in the video, so you can see a little information on that awesome contraption there.
It's got a fun little app that goes with it.
Yeah.
Oh man, it's so cool. Yeah, I was playing with
It's
it all
amazing
last
with
night.
the technology nowadays. It just blows my mind, man.
I know.
But makes a big difference in the, I would imagine, in the health of your teeth and gums and all those sorts of things. So you also offer services that they indeed separate your practice from a general practice. But before we get into all that, I want to get your feelings on another subject. So in March, like everyone else, dental industry had to deal with COVID. What shocked me and what I'd like to get kind of your opinion on was the decision that dentists were not considered essential except for in an emergency type situation. You like my air quotes there. Now, my first thought was dentists typically treat every day as if COVID existed, even prior to COVID. Were you shocked as I was? And what additional steps did you take kind of to deal with that, but make sure that your patients felt safe after you were allowed to kind of continue on as business as usual?
Yeah, absolutely. So it was super scary time, a lot of unknowns. Like I was telling you earlier, though, those state and national organizations kind of really put a lot of science into that and figured out a great way of us to be able to practice and provide this stuff that it's not non-essential.
Yeah,
it really isn't. Your oral health, it plays a huge part in your immune system. And right now, we're really wanting everybody to focus on their immune system. You go into this with a much, higher immune system that's got everything it needs. Your body's going to fight and take care of itself a whole lot better than if you did not have that.
Yeah.
And the oral environment is a huge entry point for bacteria, for viruses, for all these bad things that just play a huge part in your immune system. So yeah, we're trying to enforce that and educate our patients on, that little 6-month cleaning. Maybe for some people, not a huge deal, but for the majority of people, they need to stay on that.
Yeah.
These issues that maybe they've had for a few years, these infections they're walking around with that just haven't hurt. These are all things that are going to play a huge part in all of your health. So
there's no doubt about it. And let's face it, you were wearing a face shield long before they became popular.
Yeah,
Were you not?
the surgical mask and the goggles and the gowns and all
you're
that.
spraying down your facility was hospital clean before COVID ever existed.
That's right. We have made a few modifications to kind of even up that even more.
Sure.
One of the little small things, we closed our waiting room. So we don't allow people to wait in the waiting room. We ask them, call when you get there, wait in your car. Our big thing, we try and get people, from their car to their chair as fast as they can. We did all that before COVID too, but even now we're just trying to really streamline the process for everybody.
And honestly, that's great service. I mean, if I'm going to the dentist and you tell me wait in your car and we're gonna come get you or whatever, I'm all about it because I can sit in my car and do office work or whatever. I mean, I got a mobile office in my car, but
that's right.
But so yeah, it's the best service you could ever get at a dentist office at that point.
Yeah. So and that was something easy for us. That's a quick, easy fix. It's not inconvenient. It actually kind of is nice to do that sometimes. But another thing, we try and limit the number of patients coming in. Sometimes we'll have like a group of people want to come in, 6 or 7, sure. And we can't have that many people in one room at one time. That's just not okay. So, we've kind of limited it to if it's a family with some kids, mom will come in, maybe dad can wait in the car with a couple people. If we need to get them in, we just try and streamline that a little bit easier too.
Fantastic. Yeah. So everybody can feel comfortable.
Absolutely.
There's no worries there. Okay, so let's get into this. You also offer some pretty high-tech services over there at Advanced Dental Care. They really put you in the cutting edge of dental office / spa in that respect. So I want to talk about the machine. The machine. First of all, what is the machine called? And then we're going to kind of walk through the steps of what the machine can do. And so I'll bring up, for example, Profound, which is microneedling, and you can kind of tell me about that. But first, what is the name of the machine?
Yeah, so it's Profound. That's the name of the machine. It's made by the Candela company.
Okay.
And it is a radio frequency microneedling procedure.
Okay.
And it is, so this kind of ties into our cosmetic stuff we do. We do a lot of Botox, veneers, Juvederm, the fillers, all that kind of stuff. And now we've gotten the machines. And yeah, Profound is probably, man, this thing is amazing.
It's unbelievable. And before he gets into it, I am going to have, when you're watching this video, I'm going to actually have pictures of everything you're about to talk about.
Oh, wow. Okay.
And that way, so because you really got to see what he's talking about as well as hear it. But this is an amazing thing. So let's get into it. Now I'm ready.
So yeah, kind of break it down really simply. It causes little micro punctures in the skin. It causes cellular damage. When our body receives damage to the skin, what's it have to do? It has to repair. It has to fix that.
Right.
So you take that radio frequency energy, team that up with the mechanical damage caused by the little needle, and then, boy, you just really amplify that. It's like putting your body on steroids to repair. So you get all those healing properties come in, and it will rejuvenate your skin. It'll take skin that's, shouldn't look this way. It should look much younger, and it'll bring it back to that state. And the beauty of it is, so it's as effective. It's about a third as effective as a surgical facelift.
Yeah.
And this is a non-surgical procedure. You're in and out in a day. You got a little bit of healing time over the weekend kind of thing. And it's simple, it's easy. You don't have to worry about going under the knife, anything like that. But, some people are nervous with things like facelifts and all these surgical procedures because what if it's done wrong? What if, am I going to have scars left?
Pain.
Yeah, the pain, the healing, all that. This eliminates, 99% of those negative attributes to those type of procedures.
Wow.
And the best thing too, you're not going to have these really stretched faces. It's going to put your body back to where your body can go. It doesn't bring it beyond that.
Right.
So you have a very natural, youthful look. It's not that stretched plastic look that you'll receive sometimes. So it's amazing. It's really great. There's only about a handful of them in the state. We are the only one in the Denham Springs area. There's some out in New Orleans. There's one out in Lake Charles. I think one lady in Baton Rouge recently had gotten one. But yeah, so it
really is a separator with what you can offer. And look, if you have age spots, okay, at some point, I'm sure I'll get a little sunspot up here. So can it remove that? Can it make that go away?
The Profound doesn't really do the age spots that much, but we have what's called IPL, Intense Pulse Light. That's right. Yeah, big thing. That's been around for years and years. That's not a brand new technology, but it's continuing to get better and better every year. And the Candela people, those guys, they're on the front line of all of it. They've got the best equipment. So some people call it BBL. I think that's another term from another company. If you're not familiar with the IPL term, but yeah, it'll take those dark spots.
What about
red
spider
spots?
veins?
It can work on some of the little smaller, lighter ones, but like those deep thrombotic veins, it doesn't. You have to have a different laser for that.
Yeah. Okay. And you have something called Monteith Vantage I'm probably totally mispronouncing that. Look, he's laughing at me. He's like, Jim, you're way off. But it's laser hair removal.
Laser hair removal. Oh yeah. Super popular treatment. Man, people love that. Super easy. You can do an armpit in 2 minutes.
Yeah.
It's
what about hair on the back for a guy?
Hair on the back, guys. Yeah, we've got some guys that come in and get the chest and the back taken care of. They like to manscape. So
yeah, I'm like a gorilla. No, I'm not that bad. I'm kidding. So you can do that, and these are things that people don't realize that you offer that are some great services right there. What about the VeloShape 3? Tell me about that.
So that is it's a circumference reducing cellulite reducing machine. It's really good. And it feels good to do it. It uses that RF energy, so it warms things up. It gets all these good properties stimulated in your blood and in your skin and all that. And it'll zap some cellulite pretty nicely.
Yeah, it'll actually tighten the skin.
That's right.
And it really reduces the appearance of your cellulite.
That's exactly right. Yeah, it doesn't destroy the fat cells. We do have a machine for that too.
Yes, you do.
But it does. It shrinks them down, and you get some really nice results from that.
So in leading into what you just said, you have what's called Ultra Shape.
That's right.
Which, tell us about that. What does it do?
So Ultra Shape, it is like, so it's kind of like some of the, Cool Sculpting's a big brand people have heard of. This takes that same effect, but the technology is so much more comfortable. It doesn't freeze you. It doesn't burn you. It's you lay there. I did it a couple weeks ago. You lay there, you play on your phone, you watch a show, and you just go to town. It's just like if ladies go and get an ultrasound. Yeah. It's the same technology. It uses that ultrasound to go in and destroy those fat cells, and they are done. They bust and there,
yeah. So if you're a guy like me, you got me and you have joked about this before, but I have a little. I don't know what you call it. It's a line right there in between my eyebrows. The 11s. And the 11s. Almost like when I make that angry face or whatever. But you have a machine and it can actually help with that and make that go away.
Yeah, we've got a couple things. So Botox is our huge thing for that. That's that's simple, quick, easy. Everybody knows the safety of Botox. They know how effective it is. But we also have some things that. Botox is going to treat the muscles that cause that wrinkle, but you also have to look at the skin itself. And we've got some things to kind of work on the skin. We've got the sublative technology. That is wonderful. That is, basically it's skin resurfacing. And it uses radio frequency energy, and it just ablates all the bad stuff. It just eliminates it, zaps it out the way. Your body heals back and gives you just a brand new face.
Yeah. So, and as you just said, I mean, these are limited in Louisiana where you can get these services. So I think it's awesome that right here in Livingston Parish, we have someone that can offer all of these services in addition to, general dentistry work and all those sorts of things. That's huge. I know you were doing some get-togethers, of course, prior to COVID. My wife attended one of those and absolutely loved it. I bet you can't wait to get back to those days.
We can't, because it was such a disappointment. We had that big rollout of all the, everything we had.
Very successful rollout.
Yeah, it was really nice. Good turnout. And then boom, COVID hit. All the med spa aesthetic things, they all got shut down. That wasn't anything. Those were deemed, non-essential, obviously. So, sure. We kind of had to step back a little bit from them for a while.
Well, hopefully we'll get back to those days sooner than later. You also give a lot back. You're not, you're a very giving guy. And honestly, you participate in one of my favorite organizations, which is Freedom Day USA. So tell us what that is. Tell us a little bit about that.
That is an amazing event. We love doing that. We've been doing that before I was even in the practice. The previous dentist, he did it and carried it on, and I got involved with it. And what it is, it's a day of free dentistry to active military, retired military, and their immediate family. So they just call me up. They say, hey, we want to come into Freedom Day. We try and do things that we can do that day for them. The cleanings, extractions, fillings, some things like that. Especially those immediate needs that a lot of our military people just are not taken care of on.
Sure.
And we try and be there for them. To us, it's nothing. It's one day.
Yeah.
One day we can do this. And it just, it is a tremendous,
it makes all
thing.
the difference in the world to some people. And I think, it's a great charity in my opinion. I'm a big military person and I think it's awesome y'all do that. Absolutely. So thank you very much for that. Now on that subject, you gotta have, some hobbies outside of, I want to fill a cavity today. So what does Dr. Don like to do outside of dentistry? Do you hunt? Do you fish? Do you do any of those things?
I do, yeah. When I'm not thinking about dentistry, yeah. So I've got the two boys. They, they're getting into the outdoors things and all that. And I grew up in the outdoors. But yeah, we love to travel. We love the beach. We love the mountains. We love to do all that kind of stuff. And then fishing and hunting, that's a big part of our family and everything there. But
Excellent.
Yeah.
Excellent. So I'm glad to hear that. Hobbies are important for all of us as business owners. We can tend to overwork ourselves. I mean, especially when you're starting one. I'm sure when you first started, advanced dental care or continued on with it, there were some long hours there, and I'm sure it's long hours right now.
Yeah,
to this day.
Still some hours. The hobbies, they don't get as much attention as they need to.
Right.
But we try
never
and
do. Yeah. I mean, I can tell you sometimes I am forced on vacation by my 3 kids and wife, and thank God for it, because, you just get... you get in that mode, man, and you're just blowing and going, and your body has to have time to enjoy something outside of your work. And of course, you love what you do. It's probably not even work to you relative to you're doing what you love to do.
It's really not. Every day is a fun day. It's like, all right, what kind of fun are we going to have today? What are we getting into? Who are we helping out today? It's a joy every morning.
And the interesting thing, Dr. Don, is that's consistent among leaders, and which is what this show is all about. Is almost every episode I mention that intentionally to see their feeling on it. And it's when you're doing what you love to do, you really, it sounds cliche-ish. You never work a day in your life. Yes, you work hard from the aspect of you're pushing, but it's a different kind of push. It's a push you want to do. And I think that's the difference between a career and a job, So one thing that's common in leaders of all types is that somewhere along the line, they read a book, and this book contributed to some of their success somehow. With that in mind, I've starting with this episode, what I'm going to call the Local Leaders Book Club. So I'm very intrigued to find out what a recommendation of a book every week. I'm going to link it in the description of the video. And we're going to kind of start a local leaders library where people, if they're interested in reading a book that somebody on the show recommended, we'll link it. They can go get it from a website or go get it from a local bookstore right here in Denham Springs. So what would you recommend? What's a book that you would recommend that really had some sort of impact in your life as far as your business?
So there's this guy called David Bach. You've probably heard it. He's one of the best things. He's got this little book called the Latte Factor.
Yep.
A lot of people have heard of it. Yep. Super simple concept. But man, every single day you can take that latte factor into your life, and just financially, it will just tremendously help you in just the simplest little decisions sometimes.
That's awesome. And I have heard of it. I haven't read it, but I will.
Check it out. Yeah,
I will.
And he's got a whole series of books. He's got one for couples, on how to succeed financially, one for women on how to succeed in business financially. David Bach.
Awesome.
But yeah, the latte factor thing, his whole thing is, you can take something as simple that you do every day that may be something in excess, or maybe something you don't even think about. And he uses, a latte. You go to a coffee shop, you might spend, $5, $6. You could take that same $5, $6 every single day and put that towards something else in life that you may get more joy out of. Yeah. You may, financially may benefit you more.
Yeah, absolutely. And people don't, when it's small amounts like that, people don't realize,
you don't notice
you don't notice.
How much is that? What's 5 times 30? 150 bucks a month.
What is these math questions? Yes, 150 bucks a month. That's right. And that adds up. They do that over a year. I mean, so yeah, good stuff. And so we're going to link that book to the video of this episode. You can check it out and read it. I'm going to read it. That sounds very interesting. So we do fun facts here. I like doing fun facts regarding people that come on in their industry. So I chose dentistry, obviously, for this one. So you're going to know most of these, most likely, but we're going to have some fun with this. This is McHugh's favorite part of the episode. So here's an interesting fun fact, and I'm going to ask what you think on this. So the average American spends a certain amount of total days over their lifetime brushing their teeth. What would you think that was?
Ooh, let's see. Every single day, brushing 2 minutes a day, twice a day. God goodness, Jim. Now you're getting back to the math problems. I'd say maybe, about 6 weeks?
You're awfully close.
Yeah.
38.5 days if they were sitting there doing it straight over their lifetime, brushing their teeth. So you're pretty close.
Yes, that's right at 5.
Yes.
Yeah.
Yeah, that was pretty good. Smart dentist. So, interesting fact there. People who drink 3 or more glasses of soda a day have 62% more tooth decay, fillings, and tooth loss than those who do not.
Those are our most frequent patients, soda drinkers.
Interesting.
Yeah.
And so you're saying 6-pack a day of Coke is great. Come see him. No, he's not really saying
it's
that.
job security. I'll give you that. But man, we try and discourage it.
But interesting that you bring that up. That's your most common. And I gave up soda a long time ago. And I definitely monitor that with my kids. But it's good that it's getting out there more, because there was a time people did not realize how bad a can of Coca-Cola was for your teeth.
And we everything in moderation.
Yeah.
Yeah, little here, little there. That's not a big thing. One thing though, this is a discussion I'll have with some people. We have a lot of people who are like office workers.
Yeah.
And they'll tell me, I'll ask them those questions because I'll see all these results, the acid erosion, the cavities and things. And my first thing is, how much soda do you drink a day? I'll only drink 1 a day. But they'll sip on that same one at their desk all day long. Yeah. And it has the same effect as drinking a 12-pack, all day long. Every 5 minutes, you're taking a sip. You're putting that sugar. You're putting that acid on your teeth. And it will tear them down quickly.
It is acidic. I remember somebody, a friend of mine at one point, he took a penny and he poured a Coke on there and he's like, watch what it does. He did the same thing with Taco Bell hot sauce, and it would like make that penny just turn copper. I mean, yeah, just bright copper. So definitely moderate on that. Humus. Hardest substance in the human body is
enamel.
That's right. Enamel,
the outer layer of your teeth. Yeah.
Interesting. I would have thought the bones of your body would be your hardest substance, but that is why I sell paint and do not pull teeth for a living. So that's interesting. If you don't floss, you miss cleaning 40% of your tooth surface. Absolutely. 40%, so it's half. That's crazy. So flossing, very important.
Very important. Super important for gum health.
I know a lot of people that they brush, but they don't floss.
That's right.
Unless they, eat a steak or something, they got something stuck in there. But you recommend flossing every day?
Every single day.
Feel like you need it
at least once a day. If you can get in there and you'd be surprised. You wait a week without flossing and you go back in there and see what you pull out. You can brush every day. It's scary. Yeah.
That it is. Okay, so the average woman smiles 62 times a day, Dr. Don. The average man, 8 times a day. Why? I have no idea.
We need to fix that.
We do. But that's an interesting 8 times versus 62. So they're probably laughing at their husband for something. That's what
we give them plenty of
my
ammo.
wife probably smiles 100 times a day laughing at me for something I'm doing. But yeah, 62 times a day versus 8. More than 300 types of bacteria in the mouth. You discussed that earlier. And make up dental plaque in your mouth. So that's interesting. 300 types. I'm not going to ask you to name all of them, but there's a lot.
You want to write them down? We got a minute? No, I could not.
George Washington. Okay, so everybody says he had wooden teeth. Look, McHugh's bright. History lesson here, McHugh. So everybody says he had wooden teeth. He actually didn't. His dentures were made from gold, hippopotamus tusk, elephant ivory, and human teeth.
I know. I don't know where the wooden teeth thing came from.
I don't know either, but he did not have wooden teeth. For all you high schoolers out there watching this, it was gold teeth. And how prevalent are gold teeth nowadays? As far as, do people still go in and get them like I know in the 90s that was popular, man. You had everybody was getting a.
So not as much, but I'm gonna tell you what, a gold like a gold crown on your back teeth is one of the best types of crowns you can get. I mean, they're phenomenal. You ask most dentists if you're going to get a crown, what kind are you going to get? It's going to be a gold one. They last so long, and they're wonderful.
And the other option is silver on those usually, or?
So there are silver crowns also, yeah. But we've got, there's, oh my gosh, so many, what we were talking about earlier with dentistry changing so much, we have so many materials to choose from these days to restore teeth. And they all have very specific, little niches that they'll fill. And, that's part of the diagnosis too, is picking the right one for that particular patient.
And that's interesting, and kind of leads me into another question, which is regarding insurance. So this is a good thing that you need to cover. Of course, y'all, I'm sure, accept majority of insurances as far as Blue Cross and all those sorts of, the main ones. That's but right. Let's say you're someone and let's say you own a business and insurance for someone that's self-employed. Maybe they're a painter, for example, and they're working by themselves and they don't have insurance. So do you partner with any finance companies or anything where they can come in for these more expensive procedures?
We do.
And okay, tell me about that.
So we do. We accept a lot of insurances. There's one big thing too, Jim. People can be in network with an insurance and they can be out of network with an insurance.
Right.
Basically, if you're in network, your fees when you go to the dentist are usually going to be lower. Sure. So your coverage is better, things like that, versus out of network where, we may still accept that insurance, but it's at a higher fee or something. Sure. And it can, that can be a huge difference. So when you call your office and you're trying to see, ask that particular, are you in network with this insurance or are you out in network? Because if you just ask them, do you accept it?
Yeah.
Most people do accept all of them, but they may or may not be in network.
Gotcha.
But back to maybe somebody who doesn't have insurance or, their treatment's going to go beyond their insurance coverage. We offer some in-house things. We can extend the payments over a couple months, 6 months, something like that.
Sure.
If that makes, it a little easier for you. But we also, we use a lot of care credit. Yeah. Care Credit is it's a third-party company. You can apply through them, and they'll do some low interest and even zero interest loans.
Wow,
for extended periods of time. Yeah, so the money issue it's hard, but we try and do everything we can to make that the easy part.
Yeah.
Because that can be at sometimes the most difficult aspect.
Sure. I mean, some procedures can kind of get up there, and so it's good to know that y'all have many different options that people can go with on that.
And also going back to you talking about we do a lot of training, extensive, going beyond just our basic level of dentistry. One thing, if you go to a specialist, many insurance companies don't cover specialists, oral surgery, root canals, or if they do, they cover it at a minimum. And then too, a lot of specialists don't accept that. A lot of specialists can be cash or just the major companies. So we offer, in our office, we offer a lot of those specialty procedures and we still roll on the same insurance concept. So you can really benefit. We've got a lot of local dentists that will send us patients for those specialty procedures because of insurance purposes and things.
Interesting. Yeah, y'all definitely got it going on as far as options on that. So fantastic. Just a couple more fun facts. The average person only brushes for 45 to 70 seconds a day. What's the recommended?
Oh my God. 2 minutes a day.
2 minutes
for the average person. 2 minutes per brushing event, which you do twice a day, mornings and afternoons, at least.
But I'm probably around that 60-second range. I mean, I get kind of ADD after that. I'm thinking of 900 things. Yeah, so I need to tighten up on that. I did not know it was 2 minutes.
Yeah. Oh, and look, our guys with braces, kids with braces, man, 3, 4, 5 minutes.
Come on.
Oh yeah, braces are super hard to clean, so it takes a lot more effort.
Well, what I want you to do here is tell us where you're located and tell us where people can go online, find out more about all this stuff we talked about today.
Sure. So we are at 703 South Range Avenue. We are, the shopping center where Gaddy's Pizza is?
I do.
We are right across from that, right next to Po' Boy Express right there.
Awesome.
Office has been there for a very, very long time. You can go to our website, advanceddentalcarela.com.
Okay.
Check out, we got a list of services and things there. So, you can always check, see if your insurance is good. You can chat with us on there. We can try and get you a good appointment through the website to try and make that a little easier sometimes. Yeah, that's nice. But yeah, whole wealth of resources on there.
Excellent. What I'm going to do is I'm going to link your website and also put your address there so people will have that as well. I want to thank the man whose teeth are admired by everyone he sees, McHugh David, for engineering this podcast. My guest for today, the great dentist and always a yellow jacket, Dr. Donald St. Angelo from Advanced Dental Care, the Livingston Parish News for the space, and all you viewers for your listeners for your support. Please follow me on Instagram, like me on Facebook, subscribe on YouTube, and check out the website at paintpodcast.com. It sure helps me out. You can also listen to the audio version of Local Leaders, a podcast, on Spotify, Apple Podcasts, Google Podcasts, among many others. I would like to thank my sponsors for this show as well. I simply could not do this without all of you. And if you're interested in sponsoring Local Leaders, a podcast, or appearing on the podcast, reach out to me by emailing jim@paintpodcast.com. There is a great weekly coupon that is out in the Livingston Parish News today where you can check that out and you can get a little discount on that advertising. Keep an eye out for my next guest, Dane Arnold of iTrade Exchange. He'll be joining me to discuss his business of bartering services all over Livingston Parish. I do want to present you, sir, with two items. Thank you. This is the official Local Leaders t-shirt.
Wow.
Just for you. Wear it with
right.
pride. And this also was made by SportNCenter right here in Denham Springs. We like to promote our local folks. And he does these in-house. So I want to show these. James Adam McCants at SportNCenter does these. And these are obviously tumblers, but they laser engrave these right there in-house. It takes them no time at all. So go check them out. They're a great sponsor of the show. That is for you.
That is nice.
So
yeah, James Adam, good friend. He actually does all of our
there you
swag
go.
for us as well.
I love it. I love it. And I love swag, as everybody knows. So we appreciate you joining us. Until next time, I am Jim Chapman, reminding you, love your community, support local business, and keep leading. Thanks.